Shalom, family. Good to see you here. Hope you're doing well. We're going to talk about the healthcare costs because this is something that's hitting people all over the country. You know, Unfortunately, Congress didn't do a damn thing. So everybody's premiums are going up. And people are already saying they just won't have health insurance because they can't afford it. Some people went from paying $200 to over 1,400 bucks. Some people went from maybe like $1,200 premium to like $8,400. So folks are saying they can't pay that. It is bigger than their mortgages. So all you're going to do is now have a country full of uninsured people. That's all you're going to have. And many of these hospitals are going to have to close. It is going to be absolutely crazy up in here in 2026. Look at how this year is starting out. You know, I think this is a precursor to what the rest of the year is going to be like. And people are no longer going to care about maintaining their health insurance because they won't have the money to do so. They won't have it. I'm looking at some people online saying their premium jumped up to like $3,500. Who the hell can pay that monthly? Nobody can pay that. That is just crazy. And it's not like you're getting something more. You're getting the same coverage you had before, triple and quadruple the price. So, well, let's hear what people are saying about it because it's a lot of chatter about it online. All right. So let me share. All right, y'all. Please give me a 1 if you can see my screen. Thank you.
Sticker shock, though, for tens of millions of Americans who get health insurance through the Affordable Care Act. Congress has failed to extend the federal subsidies that help cover the cost. And the greatest impact could be in the state of Florida. Why? Because it has far more Obamacare enrollees than any other state in this country.
Our health insurance premium is effectively tripling from 2025 to 2026.
Kylie Barrios says that premium is going from about $900 to $2,500 next year. For the 30-year-old living in Florida, that means foregoing insurance.
The whole system feels as though it's failed and isn't advocating for me as a small business owner, as somebody who wants to become a mom and have a family.
Tens of millions of Americans like Barrios that rely on the Affordable Care Act are seeing premiums skyrocket. Pandemic-era subsidies that kept prices low are set to expire at the end of the month, and lawmakers have not agreed on a solution.
Self-employed people are having a very difficult time, like myself.
Marsha Levine Arias, a social worker and Democrat in Florida, pays for health care coverage for herself and her 2 adult children and says all 3 of their premiums have soared for 2026.
What would your message be to lawmakers and the president?
I would really like to take people in government who might care about people and spend a day in my shoes.
I've generally voted Republican, and I still do believe that to some extent that it is the party that better serves my values, but I would like them to act on those values that they claim to protect.
Florida health insurance broker Clifton Easerman.
I just really wish health insurance was not political. This should be like something just foundational.
Easerman advises against going without health care coverage, but Barrios says she's aware of the risk.
I'm stuck kicking the can with everybody else my age.
For her, there's no other option.
Some 22 million Americans will begin to see their health insurance premiums skyrocket after Congress failed to extend certain subsidies under the Affordable Care Act.
So we're talking about 22 million Americans And these are small business owners. These are chiropractors. These are, anybody who's not getting their insurance through their job or are not yet on Medicare. This is the Obamacare subsidies that were enhanced during COVID and then extended by Congress a couple of times. Those go away tonight. And you're talking about some families who are going to see hundreds of dollars, if not thousands of dollars of higher premiums starting right away.
Millions of Americans just woke up in 2026 with a fucked up surprise. Their health insurance just increased drastically in price. Overnight, the enhanced ACA subsidies expired, and Congress did nothing to stop it. Nothing. But I don't think anyone is surprised. These tax credits kept premiums affordable for over 20 million people. Self-employed workers, farmers, small business owners, parents, people who don't get insurance from a job and don't qualify for Medicaid or Medicare. Some families are seeing costs double. Others are seeing them triple. One mom's premium went from $85 a month to nearly $750. Another went from $350 to $500 just to stay covered. Lawmakers knew this deadline was coming for years. Democrats warned about it. Even some Republicans admitted it was a problem. Trump floated a fix, then backed off after conservative backlash. So the subsidies died. At the same time, Congress already slashed over $1 trillion from healthcare and food assistance, and now millions are being told to figure it out. Experts say nearly 5 million people could drop coverage entirely this year because they simply cannot afford it, which makes healthcare more expensive for everyone else. So that sucks. People are now choosing between rent, groceries, and staying alive. Keep in mind, this is a political choice. Affordability is voters' #1 issue heading into the midterms, and Washington just made healthcare dramatically more expensive for millions of families.
My monthly premiums effective January 1st, 2026 under the Affordable Care Act are going to go from $24 a month to $1,473 a month and 3 cents.
Right now we're paying around $950. We will be now looking at a little bit over $1,300 a month.
What are my children going to do if something happens to me?
When it comes to healthcare, we have never, ever seen price increases like this. And we have never, ever been on the brink of this many Americans losing health insurance. We don't know what's going to happen. But let me tell you something. In times of darkness, in times of fear, we need to be the light and we need to show courage. It's time to stand up and fight.
Americans may see health insurance double in 2026. Trump says he'll meet insurers to discuss costs, but ACA subsidies expired and premiums are projected to soar. Can these talks save everyday Americans hundreds, or is it too late?
Good morning, y'all. So I want to know, why is health insurance going up so high? Why is health insurance going up so freaking high? So just let me explain my situation. So I'm per diem at my job. I work at the hospital. For one, all nurses should have free health fucking insurance, and that is just my opinion. We in a hospital, we risk our lives, we should have fucking free health insurance. That's just rule number one. However, it does not work like that. So I'm with Florida Blue, right? And last year, my health insurance was like $537. It's just for myself, not for my child, just for myself, right? I said, okay. This plan going up too damn much, okay? But then 2026 come, brand new year, brand new fee, brand new cost, okay? It went up to almost $800. How do you go up $300 from last year, huh? It is becoming so ridiculous how much health insurance is. How people gonna make it? When I looked on the marketplace for insurance, those lowest prices was almost $1,000, was $900 something. Who had that? Who got that? If it wasn't for the grace of the Almighty that I was a nurse and was able to afford it to a certain damn degree, how? You're either gonna work full-time for a hospital or work full-time and make less, and then you'll have a better chance of getting health insurance through your job. But still, it's just like, yeah, where the hell is world going? And healthcare, I don't know where the hell healthcare going in Florida. That's just my opinion, y'all. What y'all think?
As you may be aware, the ACA, the Affordable Care Act, also known as Obamacare, has ended. Republicans have ended ACA tax credits. Many Americans say their health insurance went from an average of $18 a month to $650. If somebody got a health insurance, meaning their credit was $632, that means they were very, very low income. ACA Obamacare was a sliding scale on what you make. So if you made a lot of money, number one, maybe you didn't qualify for Obamacare, but you were self-employed, so you can use the health link to look for insurance. So just know that somebody who got a $632 tax credit is something like what you would get, a child tax credit, a credit for being married. It was a credit. Where do you guys want your taxes to go? You don't want it to feed children. You don't want it to house homeless people. You don't want it for nurses for the VA. You don't want it for water, air safety. Where do you want your taxes to go? Anyways, I digress. So most people in that situation have canceled their health care, which means they will not be getting preventative care. They will go to the emergency room when they're sick. And if you have insurance, they're going to be in the emergency room with you. And then if they can't pay their bill, it's going to make your health insurance go up because we now have less people and higher risk. So this was not a very good policy, but hey, I guess. Hi, my name's Christina. Drop a comment for more.
Millions of Americans are now experiencing a significant increase in their health insurance premiums. Why? Because the ACA tax credits have not been extended. Yes, they have passed through the House. The House passed to extend the tax credits. It was led by the Democrats. There were some Republicans that joined the Democrats in voting to extend the tax credits. So it passed through the House. However, it has to pass through the Senate. Could Donald Trump simply order the Senate Republicans to pass to extend the ACA tax credits to lower your health insurance premiums? Of course he could. He could send out a tweet. He could go down face to face like he did when he was worried about the billionaires not receiving their tax breaks before the One Big Beautiful Bill was passed. He marched right down there. You know, Donald Trump wants America. He said he wants to make America great again, put Americans first. Is that what you're seeing? We are day after day after day focusing on everything that we're bombarded with, from these horrific ICE raids, all of the abuse that we're seeing with DHS, right? All of the threats that Trump is making to various countries throughout the world. We're paying attention to Venezuela, the oil, the taking over of Greenland, Trump's peace board, $1 billion gets you a seat. You know, threatening Norway because he didn't get the Nobel Peace Prize because he thinks it's the government's responsibility to award that. And if he doesn't get Greenland, he's threatening Europe. You know, he has threatened so many countries. He could easily ensure that your health care premiums are lowered. And he hasn't done that. What has he done specifically for you? The only way the Senate is going to pass to extend the ACA tax credits is if you put pressure on Republican senators. You've got to make the phone calls. You've got to continue to make the phone calls and put pressure on them. Midterms are coming up, and whether you live in a blue state or a red state, it's going to become less affordable than it is today for you to continue living and being able to afford food, rent, mortgages, utilities. Forget about anything beyond that. You're going to have to make tough choices. Health insurance, car insurance, rent, food. Put pressure on the Senate Republicans because it's the only way those tax credits are going to be extended, as they're refusing to do so. It's time that Americans start advocating for themselves.
Health insurance in America is such a fucking scam. It's unreal. And I have the proof for you right here, okay? My daughter had to be in the ER before her health insurance got activated, but she still doesn't have health insurance. And I think we're going to the health sharing route because this is ridiculous. And this is why it's so expensive. And this is why it's such a fucking scam, okay? So we had to go to the ER. We were in the ER probably for like 6 hours with her in a room, like in the ER. She got a head CT. She got a 3D head CT, got it like read by all the people, whatever. I'm thinking in my head this whole time, like, this is going to be so expensive. We don't have health insurance. Like, we'll figure it out later, whatever. Okay. This is why it's a scam. So total bills, if we had insurance, so we were there as self-pay. If we had insurance, what they would have billed to the insurance was $3,860. But because we were self-pay, what our total is $1,205.99. Tell me how that makes sense. Whether we have insurance or our self-pay, her care was the same. Her treatment was the same. Why is it such a big difference in price of what is billed, whether you have insurance or self-pay? That's why insurances are the amount that we have to pay is less than what we pay per month for our health insurance. Are you kidding me? Like, okay, no big deal. No big deal to pay that amount of money. Don't pay our health insurance for 1 month. We're freaking golden. We have extra money to spend after we pay this bill.
For the American people, this is absolute bullshit. And it's absurd that we are in a body with 435 members. Everybody has a responsibility to serve their district, to serve their constituents.
Mike Johnson and MAGA Republicans, they want the Affordable Care Act to die because Obama bad. But they have nothing to replace it. Like literally no plan at all. This administration has had since 2016 to make a plan. And starting on January 1st, here in a couple weeks, people's healthcare premiums are going to skyrocket, possibly double. And that is going to devastate communities, absolutely fucking devastate. And this is a huge story. Everybody's talking about it. This ground news story has hundreds of sources, hundreds. And yet, only 6% of right-leaning media is covering it. And the reason is simple. When healthcare premiums skyrocket, which they are going to blame Democrats, immigrants, and weirdly, probably trans people, like they always do. If you have been following me for a while, you will know that I try to be a man of...
The Federal Benefits Administration just announced a 2.8% cost of living increase for 2026, affecting 75 million Americans starting this January. The average retiree will see about $56 more per month. Medicare Part B premiums are also rising to $202.90 monthly, up nearly $18 from last year. Since Medicare premiums are deducted directly from retirement benefit checks, your actual increase will be closer to $38. For working Americans, the payroll tax cap increased to $184,500. This means higher earners will pay retirement program taxes on an additional $8,400 of income compared to last year. If you're 65 or older, a new $6,000 tax deduction is available when filing your 2025 taxes. This may help reduce taxes on retirement benefit income. Married couples can claim up to $12,000. Review your January statement to understand your specific benefit amount and any deductions.
I have been a physician for 35 years and sadly have had a front seat to witness the decay and decline of one of America's largest industries, and that's the health insurance industry. I have had patients cry in my room. I have had physicians cry to me, throw up their hands in disgust and quit because of actions of our health insurance industry. There has been systematic denial and delay of care. It took me 8 denials myself to get a medicine that I need to exist. A year and a half. I'm a physician and a member of Congress. It took me 8 times through CVS to get that medication. I didn't pull any strings. I did what I was supposed to do. Imagine the average person in the country. We know how money gets moved around in these companies. The C-suite executive salary compensations is a slap in the face to the average American who goes bankrupt because they cannot afford health care. The vertical integration, you guys own PBMs, you own pharmacies, you own health agencies, physician groups. Good God, you own a bank. Why would an insurance company own a bank? You know, I don't agree with Mark Cuban often, but we do agree that what needs to happen is that you guys need to be broken up. The vertical integration has destroyed competition in this country. And again, if I had my way, I'd turn all of you guys into dust. We'd start back from scratch. We'd have competition in the industry. We'd have associated health plans, and we would have nonprofit hospitals rather than profit being put over patients. Sadly enough, I'm not naive enough to believe that anything that's been said today is going to change boardroom behavior. I don't think it will happen. The bottom line is profit. And that's what's happened in this country. And this is where the American medical system, compared to the rest of the world, is sad.
Well, Donald Trump made the statement, how come we can't get more people from Norway? Those people get free health care. They probably get free education too. Why would they leave that and come to America? Nobody that gets all of that stuff for free is going to come and give that all up to live in America. Donald Trump is an idiot. And number two, ladies and gentlemen, people that just don't have the income, and most people on Obamacare, they don't have a lot of money. So the fact that you're putting premiums up that high for people that didn't have a lot of money to begin with is just outright stupid. Donald Trump, one thing I can say, you will lose these midterms. You will lose. And as far as Mike Johnson, they said Mike Johnson got Congress on lockdown. That's why every crazy thing Donald Trump does, you notice they don't come out strong speaking out against Donald Trump. That's because of Mike Johnson. He got them all on lockdown. So whatever he does, they're too scared to come public and say, you know what, I don't agree with this. And these premiums shouldn't go up, or this should not be happening. No, they're too petrified. And to me, a scared politician is a useless politician. Perhaps y'all should not run for your seat again if you're that petrified. So, y'all, my heart goes out to all of the people that are dealing with that. I know we're dealing with our issues with my family because, my husband is now unemployed. So, it's tough out here and it's going to get worse. And the impact of this is going to be really bad. It's not going to be just people with high premiums. You're going to have more hospital shutdowns and more people leaving the medical field. So y'all get ready. It is about to go crazy up in here. And they don't care. That's the intent. Donald Trump, I really believe his intention is to destroy this place. And it's definitely working. It's definitely working. So, y'all, this is my final live for today. So we'll be back tomorrow on all new topics. Please enjoy the rest of your day. Shalom, family.